Assalamu alaikum wa rahmatullahi wa barakatuh. Today we'll talk about a symptom that is very common in this environment and elsewhere, headaches. Pain in the head is very common and it may indicate or imply that something else is going on in the body. There are different types of headaches and there are different reasons for which one can have headache. The important thing to note is, why do I think I've got this headache? Sometimes it may just be a tension headache. You've overstressed yourself, you're overworked, or you have some problems that is affecting you. It could just be a tension headache, which after you take a rest might go away. Sometimes it's related to another illness. For instance, you could have fever alongside the headache. You could have anorexia, that's loss of appetite, and some other things. And when you go to the hospital, you'll be told, oh, this is why you had this headache. Occasionally, we have a one-sided headache. And most often, once an individual has a one-sided headache, the next word you'll hear is, oh, I've got migraine. But how do you know whether you have migraine or you just have an ordinary migraine? Simply put, most migraines are one-sided, although they could also be generalized. But in most instances, there's some other factors or some other occurrences that will let you know, oh, this headache is different from the others. In some instances, some people have a warning sign, an aura. They could have some visual disturbances or see flashes of light or begin to feel that, oh, my ear is twitching and all that. They know that, oh, I'm going to have this very serious bout of headache. And often when they have migraines, what they want to do is keep away from everybody, stay in a dark room with no light, the place is quiet. And when you make any little noise, they're on your neck. Such headaches, of course, need to be properly diagnosed and properly treated. You cannot stay at home and say, I have migraine. Indeed, if you do have migraine, it's not something that you can treat on your own. Now, a sudden bout of headache, especially in someone who has a history of hypertension, is a very dangerous headache. It could be showing to you that you've just suffered a form of stroke called subarachnoid hemorrhage. And of course, unless you go to the hospital and get properly diagnosed and properly managed, you may actually be heading for a problematic period. In essence, what I'm saying is that headache is not ordinary in most instances. Okay? If you had a head injury, the headache that you might suffer would actually be located on that side of an injury. You already know I suffered a trauma. But you keep having recurrent episodes of headache, you need to get yourself checked. What is it? Is it from my eyes? Do I have a problem with some structure in my brain? Or like I said, has this individual suffered a stroke or is in the process of having a stroke? Or does this individual have a serious hypertension? Something must have led to this headache that you are having. The problems with my eyesight, am I straining my eyes too much? Do I need to go and see my ophthalmologist? You must do something about that headache today, especially if you've been taking analgesics and nothing has happened. Please do not stay at home and say you have ordinary headache. There's absolutely nothing ordinary about most headaches. Assalamu alaikum wa rahmatullahi wa barakatuh.